Is this thing on? Hi guys. All right, I'm gonna look for Dr. Ingels here. And can I like add a little title? I don't want to knock anything over. This is all precariously set up here. Hooray, it's working. Hi. So I'm gonna have on Dr. Ingels in a second. I'm just gonna, oh, here we go. Did I do it right? Huzzah!
Oh, we're getting there. There we go.
We did it!
Slow to connect.
That's me. Hi, Dr. Ingels. I'm going to do a little intro real quick, and then I'm going to just ask you some stuff, if that's okay.
Absolutely.
Cool. So this is my doctor. This is Dr. Darin Ingels. He is a naturopathic doctor who specializes in chronic immune conditions, including Lyme and other things like autism, allergies, asthma, PANS, and PANDAS. Am I on the right track?
That's pretty much it.
He's been in the healthcare industry for almost 30 years. He's been published extensively, including authoring several books, including this one, The Lyme Solution. Yeah, and he's just the man. So I'm so excited to have you on here and answer some questions. There were so many questions. I'm so happy everyone's like curious and excited to learn more. Yeah. Is there anything,
thank you.
Can you like brag on yourself for a second and tell us more just about who you are and what you do?
Well, a naturopathic doctor by training, and I was actually a clinical microbiologist before I was a doctor. So I worked in a hospital lab for 5 years dealing with bacteria and viruses and all these other infectious diseases. So actually was a good lead into my now professional career, you know, dealing with Lyme disease. And I was a Lyme patient myself. So, you know, I lived in Connecticut for almost 20 years and got Lyme disease. And I spent, you know, over 3 years trying to get my own health back. So for people who've gone through that struggle of a chronic illness, I mean, I've walked in your shoes. I know exactly what it's like to have those days where you can just barely drag your rear end out of bed and you're tired and your brain doesn't work and your joints hurt and your nerves are on fire. And it's just so incredibly frustrating. And what's interesting is, you know, I relocated out to California. I mean, I actually grew up out here, so I'm a California kid by nature. But after living in Connecticut for almost 20 years and coming back out to California, I was just shocked at the number of people I was running into where their doctors just, they didn't look for Lyme, they didn't think about it. And it's crazy that even the CDC says California is the 5th fastest growing state in the country for Lyme disease. And it just wasn't on people's radar. And I just, for the life of me, couldn't grasp it. And I swear I see more Lyme patients and mold patients in California than I did living in Connecticut. And for those who don't know, Lyme disease is named after Lyme, Connecticut. It's a city in Connecticut where they discovered this illness. So, I mean, Connecticut is the hotbed and literally the original epicenter of Lyme disease. So, of course, you expect to see it there. But out here in the West Coast, it's virtually ignored by a lot of practitioners. And so I'm so glad you're having me on tonight. So I'm hoping we can educate people about, you know, what it is, what to look for, and hopefully, you know, get some people some answers.
Yeah, same. Me too. I was really surprised when you told me that because I too thought it was like something that was more like back east. And even now when I tell people about it, they're like, how the heck did you get Lyme out here? And it's not like we don't have ticks or other ways to get Lyme. And I wanted to ask you that too. A lot of people are curious, like, how do we get Lyme? Is it just ticks or, you know, and all of the things like about like, will you know when you get bit by a tick and all of that?
Yeah, well, I'd say the overwhelming majority of people do get Lyme disease through a tick bite. That I'm sure accounts for 90+% of people who acquire Lyme disease. You know, the problem with these ticks is they're teeny weeny tiny. There's the size of a poppy seed. And ticks, if you get on your skin, they like to go to the dark, warm, moist areas of your body, you know, behind your knees and your armpit and behind your ears and your hairline. So often places that people can't see, don't look at. And if you happen to be out hiking one day or mountain biking and you brush across a tick and it gets on you, you may never know. And unlike a mosquito bite where you would feel it, ticks have an anesthetic in their little jaws. So when they bite you, you don't feel it. So you don't feel the tick bite. You can't really see it. And, you know, one of the characteristics of Lyme disease is this classic bullseye or target rash. And the CDC says that, you know, 70 to 80% of people who get Lyme disease get that rash. However, the research shows that it's probably in the mid 40%. And those of us in the real life Lyme world said it's probably less than 10%. So if you happen to get the rash, I mean, we know, I mean, when I got Lyme disease, I had every classic symptom. I had a headache, I had 105 fever, joint pain, neuropathy, and I had a big bullseye rash, but it bit me on the back of my left leg, kind of underneath my butt cheek. And I didn't know, I can't see my behind me. And I was actually getting ready to go to the hospital because I thought I had meningitis. I had meningitis when I was in college, so I thought I had it again. And I was with somebody who noticed as I was changing clothes, they're like, "Oh, what's that on the back of your leg?" I'm like, "What do you mean?" And I did the double mirror thing, and here's a big, huge target. And I'm like, "Oh, well, I know what it is now." But I was lucky. I mean, I saw the rash, or someone else saw the rash. So if you find it, I mean, that's great. I mean, then you kind of know what you're dealing with. But so many people don't get that rash. And you know, without that and some of these sort of classic symptoms, you know, they call Lyme the great imitator, the great mimic. It literally looks like hundreds of other different conditions. I mean, if you get, you know, fever and joint pain and your glands swollen and you're tired, I mean, it could be mono, it could be some other infection, it could be mold. So it'd be very easy to go to your doctor and they think it's something else. Or the more common scenario is that, you know, they test you for 1,000 other things. Everything comes back on your lab work looking normal. And they say, well, I can't find anything wrong. Go home, get some rest, don't stress, drink more fluids. Like, well, great, but that doesn't really get to the core of the problem. So, you know, again, tick bites account for, I think, the majority of people who get it. There is now evidence that if a mom is pregnant, that she can pass it to her baby. And moms with Lyme disease can, you know, induce, you know, birth defects in their babies. Sometimes the babies are born stillborn. It's associated with developmental delays. So we've now got several studies showing that that can happen. And beyond that, I think other biting insects. There's questions about whether mosquitoes, fleas, transmit Lyme. There's a few studies out of Europe that shows that the insects do carry Lyme. However, they haven't really shown whether they can spread it or not. I've seen people who live in areas that don't necessarily have a lot of ticks that acquire Lyme. Is it from another biting insect? You know, unfortunately, we just don't have the research. You know, there's no money going into this. For as epidemic as Lyme is, it's amazing how little our government spends on research. And then the one that everybody wants to know is, can it be acquired through sexual activity? And again, the answer is we don't really know. There's one study, Dr. Ray Stricker up in the Bay Area did a study where he looked at the semen of men and vaginal secretions of women. He did find Borrelia in the low 20% of these people, but of course, didn't show whether it could actually be transmitted through sexual contact. So the truth is we don't really know because no one spends the money on doing research. The reality is I see couples where one person gets Lyme and then somewhere down the line their partner gets Lyme. Now, is it they live in the same environment? Was it through sexual contact? I tend to err on the side of caution. And if one person's infected, I recommend using a barrier method, just like you would for any other infectious disease, until we know better. I mean, I think it's a risk we don't necessarily have to take. But again, there's just a lack of research and, you know, we don't really know.
Yeah. And then on that same train, I was speaking about it the other day, so I think maybe that started a lot of questions too, like why is Lyme so epidemic? Is it just more awareness? Is it being overdiagnosed, misdiagnosed? Is it because of the transmission possibility? Like, what do you think that is?
It's a combination. I think it's a lack of diagnosis, misdiagnosis, and the things that used to kill off ticks don't kill them off anymore. You know, our winters don't get as cold. You know, the cold does kill off ticks. So we used to get a reprieve in the wintertime, particularly when I lived in New England. You know, it would get below freezing and that would kill off the ticks. But, you know, with climate change, these ticks now survive. We also know that birds are migrating further away from where they used to. And these ticks can get on birds. The bird flies from, you know, Connecticut to the Yukon, and now it lays down and those ticks can start to breed in wherever the bird lands. So we're seeing the spread of these ticks. Again, we used to think it was New England and the central part of the Midwest. That's always been epidemic areas. But again, it's been reported in all 50 states in the United States, on pretty much every continent around the world. So these ticks are there. You know, there are different species of Lyme as you kind of go around the world. But I think between, you know, the spread of the ticks, you know, the natural predators for ticks like possum, the possum population's dying off. So there's less things to get rid of the ticks. So the ticks continue to explode. And as it gets warmer, people spend more time outdoors. I mean, I can remember when I first moved to Connecticut, those winters were cold. I mean, we hunkered down, you know, for the winter, we hibernated. But as it got warmer, I mean, you would go out in the woods, you would go take a walk, because why not? I mean, the weather was nice. So as we as humans spend more time outdoors, I think, you know, compounding all that is, I think the general societal health of most Americans is poorer. And that also contributes to any kind of chronic infection. I think what we're seeing with COVID-19 is a pretty good example of that, that the more unhealthy you are, the greater your risk of getting any infection. That includes Lyme. So that combination of, you know, more exposure, less immune resilience, a lack of diagnosis, all of this, you know, can really contribute to, you know, literally millions and millions of people having Lyme. And it's interesting because the CDC used to say that about 300,000 Americans got Lyme disease every year, new cases. And they just revamped that a few months ago. And now it's 476,000 new cases. And we know that's underreported. So, you know, you do the math. Remember, this is new cases every year. So we're literally talking about millions and millions of people in the U.S. alone living, you know, with Lyme, and many of them not understanding that that's what's going on, and that's why they feel so terrible. Right.
Yeah. What do you think would be best prevention then, since this is such an epidemic?
Yeah, I think if you're going to be outdoors, particularly if you're in areas that are wooded, if there's a lot of, you know, shrubbery, you know, I think it's a little bit different when you're out on like here in California, and we've got all these great paths through our hills. I'm not sure I'll call them mountains, but, you know, hills. And if you're on a cut path, you're less likely, because again, ticks don't jump. You know, it's brushing up against something where a tick is already there. So if you're going to be out camping, mountain biking, hiking, you know, really anything in the wild, you know, wearing long pants, socks, shoes, long sleeve shirt, wear a hat if you're going to be going in areas where your head might hit something, that's going to greatly reduce your risk. And there's some really great non-toxic products like essential oils that have been shown to be effective at preventing tick bites. So what I like about these natural products is that you can spray it on your clothes. And if it gets on your skin, it's fine because they're not going to damage your skin. I don't recommend using DEET. That's the common tick repellent, but DEET is very toxic. And particularly for kids, I see these parents sometimes slather the kids in DEET, and like your poor little kids' bodies, you know, they just don't have the capacity to handle these toxins, and your skin's just a big sponge, right? It absorbs all these things you put on it. And, you know, you get out in the woods, it's a hot day, you start sweating, you open up the pores, and all that chemical gets absorbed. So, you know, using a natural product will be much safer, but a barrier protection like long clothing is probably your best protection. And then, of course, if you're going to be outdoors, you know, make sure you do tick checks. You know, I used to have all my patients, and I do it now. It's like, look, if you love doing these outdoor activities, there's a lot of benefits to being outdoors and forest bathing and grounding, but you just need to do it in a safe way. So I don't necessarily want to stop people from enjoying the outdoors, but I think we need to be smart about it and make sure that we protect ourselves as much as possible.
Yeah. And so if someone does end up finding a tick, what is the best thing to do?
So if you ever find a tick on yourself, particularly if it's already embedded, a few things. Make sure you always keep a nice set of fine tweezers. In fact, they even make these cool ones now you can get on Amazon that's got a little magnifying glass attached to it so you can see the end of your tweezers. You want to try and grab the tick by its head and lift it up very slowly. You don't want to yank it out. And these old wives' tales of burning the tick and putting, you know, Vaseline on it, don't do that, because essentially if you kind of scare the tick, it can have an injection of its own saliva into your blood, and it increases the risk of transmitting whatever it's in its saliva. So just gently pull the tick. Don't have to yank it. Just wait. Eventually, if you keep pulling slowly, it'll probably release its jaws. You can pull the whole tick out intact. And then you want to try and save the tick. So just get like a Ziploc baggie, put that tick in, you know, inside, and put like a little damp cotton ball to keep it moist so it doesn't dry out. And you can actually send these ticks to any number of different labs that can test the tick for Lyme and any of these other types of infections that ticks can carry. So I like to test the tick. It gives us a little extra information about what that tick might be carrying. And then, you know, if we know the tick's embedded, and this gets to be a little bit complicated for some people too, because most of the types of ticks that carry Lyme are called deer ticks. There's other types of ticks out there. There's dog ticks and wood ticks. They're different species. As far as we know, these other ticks aren't as likely to carry Lyme. So some people, just by looking at a tick, can't tell the difference. Deer ticks tend to be much smaller than a dog tick or wood tick. If you're an outdoors person, I highly recommend go to the University of Google, start typing in pictures of deer ticks and dog ticks and kind of familiarize yourself with which one's which. And if you're not sure, save the tick, send it to the lab. They'll tell you what kind of tick it is. They'll still do the testing. And even though Lyme disease specifically is mostly carried by deer ticks, there are other infections that you can get from dog ticks and wood ticks. So it's not like it's completely benign either. So I like to have the tick tested off and be sent to be tested. And if you don't really know, my feeling is if someone comes into my office and says, hey, look, I pulled the tick off myself this week, we treat until proven otherwise. It can take a while for symptoms to start, and the sooner we can get ahead of it, the better. So we can't necessarily test someone immediately because the tests that we have are mostly antibody tests, and it can take a while to make antibodies. So we usually have to give it, 2 to 4 weeks to do the antibody test. But my feeling is start treatment right away, get the tick tested, and then once we get a chance to get the tick results back, test you, see if you're had any kind of immune response to it. Once we get all information, we can decide whether we need to continue with treatment, if we can stop treatment, if you've developed any symptoms. Most people will develop symptoms within the first, few weeks if they've been exposed to one of these infections. So we'll kind of know clinically whether that's part of the problem. But again, it's just one of those things where I don't want to take any chances. For the people who are, I guess, fortunate enough to find the tick and pull it off, I mean, that's great. More often than not, what I see is people have no recollection of any exposure. So again, if you happen to find that tick, try and save it to the best of your ability. There's a couple labs. Tickreport.com is great. I use a lab out of New Jersey called Medical Diagnostic Labs. They'll all do comprehensive testing for Lyme disease and Bartonella and Babesia and some of these other co-infections. So we know what the tick's carrying. Doesn't tell me that was transmitted to you or not, but we'll still do testing on you for the same infections. And between the two, we can figure out what your exposure looks like.
Right. Okay. And then, so what about the people like me who never saw a tick, never had a bullseye rash, never had an acute infection that we're aware of? And then, I don't know when my infection occurred. I know that I've had symptoms that could be Lyme for over 20 years. And there's a lot of people that are showing up, asking me questions saying, I have such similar symptoms and what those symptoms might look like. And then who should get tested for Lyme? What's the next step for people like me that don't know they had it? Let me just share a little bit of my story for anyone that doesn't know. So I have had symptoms come and go for the last 20 years that would include things like joint pain that migrates to different joints. I had knee pain last week, really bad for 3 days, and then it just went away. But now I have something weird in this shoulder, and there's nothing wrong with my joints. It flip-flops and goes around. I have some fatigue that's really weird and fog-like in the middle of the day. I had chronic migraines for years that might have been sinus infections, sinus pressure, we don't know. Lots of kind of weird things that didn't all add up to one thing, but then at one point started to really look like multiple sclerosis, but ruled that out too. So there's a lot of people like me who have these kind of mysterious symptoms come and go that can flare up more at other times. And I had no idea. Lyme was not on my radar until we got to the MS point. And when I started looking into multiple sclerosis and trying to figure out what is this? Is there anything else it could be? That's when Lyme kind of entered the scene for me. And then once we ruled out multiple sclerosis, I started thinking okay, well, this is something I really do need to address. But for me, that became very overwhelming because maybe you can touch on this too, Dr. Ingels, but Lyme has a very weird reputation, and some people don't even believe that chronic Lyme exists. And then testing for it can be really tricky because some doctors don't acknowledge it. The diagnostic is kind of fuzzy here and there. So maybe if you could help us understand, if you end up with weird symptoms, don't know where to look, and you think you need to rule out Lyme, what do you do, and how do we know that the diagnostics are reliable?
Yeah, I mean, it's a mess. Honestly, yeah. It's a mess, and this is what I'd say, for anyone who's had these chronic persistent symptoms, the red flags for me is I've had these ongoing symptoms for months or years. I've been to multiple specialists. Everything comes back looking normal. Particularly when you talk about the combination of neurological symptoms and arthritic symptoms. That combination is very typical for Lyme and other tick-borne illnesses. And again, a lot of the standard blood test, MRIs, everything kind of comes back looking normal. So that combination of symptoms is a red flag. And I understand there's over 100 symptoms associated with Lyme disease. That's why we call it the great mimic, the great imitator. It looks like so many other things. But, when you start to see, the brain fog and the memory issues and the fatigue and the sleep problems and the joint pain and the muscle pain and the neuropathy, it starts to narrow that window down between, various autoimmune diseases like MS or Lyme. But again, a lot of these neurological things, we'll pick up if we do an MRI or other types of imaging studies. And in Lyme, most often those imaging studies look normal. So, there's such a fine line between Lyme, autoimmune disease, and then I know we'll touch on it a little bit later, but mold. Clinically, they look all very, very similar to one another. So the common question I get is, well, what's Lyme causing? Which symptoms are Lyme related? Which ones are mold related? Which ones are immune? And I go, yes. And the reality is that it's almost impossible, for any of us to really know how much each part contributes to the totality of everything you experience. And look, as a Lyme specialist, I can tell you, I don't want to ever hang my hat that everything's Lyme. It's certainly a contributing factor for a lot of people, but sometimes we start going down the treatment pathway. It's like, okay, well, my joint pain got better, but you know what? My brain fog is still horrible. Well, maybe the brain fog isn't Lyme. Maybe the brain fog is something else. So, what gets to be very frustrating for you and I is that we keep going down these different rabbit holes to see what's your exposure been. And I think the reality is probably 80% or more of my Lyme patients, it's never just Lyme. It's Lyme plus something else. And we have to start going down, because the way I think of it is if you're standing on the lake in the morning and it's a nice quiet lake and a motorboat goes blowing by, the boat can be long gone, but the waves are still rippling in the wake. And Lyme does the same thing to the body. It just creates a wath of destruction that, even if we're effective at eradicating Lyme, we still now have the immune problem. We have the endocrine problem. Your hormones are all messed up. You've got now allergies to food and mold and pollen and these things that never bothered you before. So we have to clean up the mess. We have to go back now and fix all these things that Lyme kind of broke. And so that's why often, we start talking about all these other types of tests and things we need to investigate to see what other damage has Lyme potentially done to your body. And that's why, again, from your standpoint, it's just like, oh my gosh, I feel like we're just doing all these, million different things. And it's unfortunate, but it also gives us the best picture to know what do we need to treat? What do we really need to do? And I will tell everybody that if you have Lyme, your Lyme is your Lyme. And I think the worst thing you can do is go online, go on Facebook, and go onto all these groups and read about what other people experience. To be perfectly honest, it is a disservice to everybody dealing with chronic illness, because you're getting one person's perspective on their experience. And it's not to invalidate everyone's experience. It is what it is, but that's their experience. And for every treatment that I've used for a Lyme patient that's been brilliant and worked for one person, it did absolutely nothing for the next person. So that's why, we all have our unique biochemistry, our unique experience. You also don't get the perspective of other people online about other comorbid conditions they have, other things that they're exposed to. So we're always comparing apples and oranges when we look at what other people are experiencing and going on. So it's really hard, I think, if you go online and say, well, Joe from, Montana says I should be taking this herb, or I should never take an antibiotic, or I should do this and this. And it gets really, really confusing. So, I think the best thing you can do is, get in the hands of a professional who has experience dealing with this, that can really hold your hand and walk you through. Because from our side of the desk, we have the experience of working with lots of people. We get to see what works, what doesn't work, and have some strategy of, we're going to do this and this. We don't necessarily have to throw the kitchen sink at you, but we need to have a methodical way of how we work through things so we can really figure out what's going on with each person.
Yeah, that's so true. So what's next step then? So you think you might have Lyme. What do you do?
Oh, so you were asking about the testing too. Let me cover that briefly. So the testing, as I mentioned, is pretty much terrible. And again, for a guy that used to work in a lab, and I did this test for a living, if you want a really good test in a lab, you want that test to be about 95% sensitive. And what that means is that if you have the illness, you want the test to be positive. You want it to pick up the actual problem. When you look at the research on the standard test that's done by Quest and LabCorp, it's about 43 to 46% sensitive. That translates, it means it literally misses more than 50% of people who have Lyme. And to make it worse, it's an antibody test. So what that means, it relies on your immune response to get picked up. The further you get away from your exposure, we know that immunity wanes with time. So what if you got bit 6 months ago, a year ago, 6 years ago, 20 years ago? Why would I expect your antibody response now to be the same as it was at your time of exposure? And I think what happens for a lot of people too is that you could have been bitten by a tick at a time where your immune system was really robust, your immune system handled it, and the Lyme was kind of there, but it was dormant, it was quiet, it didn't really bother you. And then something happens, you get a mold exposure, you go through some stressful life event, and then it flips the switch and it turns on, and now what was dormant actually becomes very active, and now you become symptomatic. So, you know, I can't always tie it in that your exposure happened recently. Your symptoms might be recent, but your exposure could have happened a long time ago. And there's nothing in the testing that really gives me any sense of timing. You know, we do IgG and IgM testing. You know, if you guys don't know, IgM is the antibody we associate with acute exposure. IgG we associate with more chronic exposure. The rules kind of get thrown out with Lyme because you can come in and out of being IgM positive depending on activity, even if you were exposed 20 years ago. I mean, I got bit in 2002. So literally it's been almost 20 years and I still test IgM positive. So, you know, it's not a great indicator of where you are. Again, all that test tells me is you've been exposed. Lyme disease, even if you're on the CDC's website, it tells you it's based on signs and symptoms and do you live in an area that's endemic for ticks. The test is really just there to confirm your suspicion. I have a lot of people where we do the testing, you know, even with the best labs in the world, you know, the test comes back negative, and sometimes it comes back kind of gray, you know, it's like, maybe you've been exposed. But if you've got the clinical symptoms, so it's the symptoms, it's the test. If your test comes back positive, I can tell you false positives for Lyme testing is almost non-existent. False negatives are extremely common. And, you know, have you ruled out everything else? So we still have to go through the process. Yeah, rule out MS, rule out other autoimmune diseases, rule out other possibilities. But, you know, when I was in medical school, I learned if it walks like a duck and quacks like a duck, it's probably a duck. So, you know, we've got to use our best clinical judgment. And again, this is even the CDC guidelines. So any doctor out there that says, well, your Lyme test was negative, you don't have Lyme, they really don't understand Lyme. And even the infectious disease doctors, which I'm kind of gobsmacked by, kind of follow that same guideline. And what's amazing, in 40 years of research, I mean, we really discovered Lyme in the early 80s, even though the first cases came out in the late 70s. You know, we've never changed that criteria. The test that's out there that's commercially available was never designed to diagnose Lyme disease. It was designed to monitor people that had known Lyme disease. So these were the people that had the bullseye rash and all the classic symptoms. So anyone who's relying on that test as a diagnosis is really missing the boat. So again, we have to base it on, you know, people's clinical experience. Again, if we get a test, and again, there are labs out there that do better testing than, you know, LabCorp and Quest. So IGeneX up at Palo Alto, California, MDL in New Jersey, and there's a few other labs I think do really good testing. And then part of it's the interpretation. Again, you know, I know as a former microbiologist, know what to look for. And we know with these antibody tests, some of these antibodies are very specific to Lyme and some of them aren't. And so, you know, the CDC criteria is that you should have 2 out of 3 IgM antibodies or 5 out of 10 IgG antibodies to call it positive. Well, what if you only have 1 IgM antibody, but it's a Lyme-specific antibody? And what if you only have 4 out of 10 IgG? You know, some of these antibodies are very specific to Lyme, some of them are non-specific. And again, why we've never changed the criteria to really just look at the Lyme-specific antibodies and maybe kind of ignore the non-specific antibodies, you know, I don't know. But if you've got 1 Lyme-specific antibody, and specific if it's an IgM antibody, isn't that significant? I mean, to me, it's like being a little pregnant, right? I mean, you are, you aren't. So, I mean, is there such a thing as a little Lyme? You know, well, I only got a little Lyme. I only got a little hepatitis. I only got a little cancer. I mean, when you've got that exposure, it can clinically be hugely impactful on the way that you feel. So in my world, when I see Lyme-specific antibodies, it at least confirms there's been exposure. So I know you have that exposure. You've got the clinical symptoms. I've done my due diligence. I've ruled out other possibilities. And now we start the process like, okay, let's dive in and start treating this. And the other side of that, if you start treating and you get better, you know, that's also kind of confirming your diagnosis because the treatment's working.
Right. Yeah. And, you know, there's been so much talk in this last year about long haulers in regards to COVID. Is that similar to what someone might experience with chronic Lyme? Is that a long hauler kind of situation?
I think everybody, absolutely. I think every chronic Lyme person in the world, when they started hearing about long haul syndrome, they're like, well, welcome to our frickin' world. You know, long haul syndrome is not new. This is not a COVID-19 thing, you know, and there are so many infections. Chronic Epstein-Barr infection,
Yes.
chronic Lyme disease. There are a gazillion infections that cause this long haul syndrome where people are tired. They want to sleep all day. Their brains are foggy. So the COVID-19 thing isn't new at all. This is a common sequela of having an infection, particularly an infection that can impact your brain. Viruses can do it. Bacteria can do it. Fungi can do it. Probably some parasites do it. So this is not a unique thing. But yeah, I think everybody in the Lyme world started looking at the COVID-19 long haulers like, you know, yeah, exactly. We've been dealing with this for the last 40 years. And in some weird way, honest to God, I'm hoping that the whole COVID-19 thing is bringing a light and awareness to Lyme disease, because there's so many parallels between these two infections and how they've impacted people. And then they say, well, it's only been a small percentage of people. Yeah, but for the people who are impacted, it's pretty significant, and it really messes up your life. So yeah. I'm hoping the shining light at the end of COVID-19 is that maybe, you know, legislators, public health officials, anybody involved in the Lyme world will start to have that awareness that, oh, yeah, we have bad testing out there. Look at all the complaints we've heard about COVID-19 testing. It's been a disaster for a lot of different reasons. You know, Lyme testing has been a disaster for 40 years. And, you know, we've never, I mean, like I said, we haven't had any new testing in the Lyme world in 40 years. You know, the labs out there I consider good. They're still doing the same type of test. I think it's a better quality test, but the methodology is really the same. You know, unfortunately, the best way to measure any bacteria is to culture it. And it's just very difficult to culture Lyme because we don't even know where Lyme is in the body. Where's the best place to culture it? Is it in the blood? Is it in the spinal fluid? Is it in the tissue? You know, if we had a better sense of where Lyme goes in the body, and we know it can go pretty much anywhere, where's the best place to grab it to try and culture it? But it's a very, very difficult bacteria to culture. You know, even if you knew where to find it, the ability to culture it is really, really challenging. There was a lab in Pennsylvania that operated for a while. They were doing a Lyme culture, and the FDA shut them down. So what kind of promise we had of doing culture got stifled. So we're kind of back to having the same, you know, standard, you know, blood antibody tests.
Yeah, it's a bizarre world where you're like, that chronic Lyme can't exist, but there's all this other, now we're talking about long haulers. You know, it's like, it's very interesting about these things.
This comment of chronic Lyme not existing, I mean, I am completely baffled. We have so many studies. Johns Hopkins has really been, I think, one of the leaders in research on chronic Lyme. There's a Dr. Zhang out of Hopkins who's done a lot of research. And what they found in the lab is that there's these certain percentage of Borrelia, that's the bacteria that causes Lyme, that are called persister cells. And what they found in the research is that these certain percentages, they're just resistant to particularly antibiotics. You know, you can give the strongest antibiotics in the world, and these bugs basically flip at the bird and say, we don't care, and they persist. So, you know, Richard Horowitz, who's one of the big Lyme gurus out there, you know, he's been doing combinations of different antibiotics to try and go after the persister cells. And I know when he lectures, he said, hey, look, this is the closest I've come to curing Lyme disease. Unfortunately, these drugs are horribly toxic. You've got to get monitored every week because of the toxicity. People usually feel horrible on it. But the idea is that, you know, there's this certain percentage of cells that may be difficult to just completely eradicate. We're also left with this question, too, of, you know, do we really completely eradicate Borrelia? And the truth is we don't know. I am of the opinion that I don't think we ever completely eradicated 100%. I think, you know, again, if I tested everybody who lives in New England and Minnesota, Wisconsin, I think we would find a high percentage of people that have antibodies to Lyme that never got symptoms. So it may be like COVID-19 too. There's some people who get exposed who are very much impacted by it, and other people, you know, because of their terrain, have very minimal impact. So, you know, it's just one of those things where, I don't know, it's just, I think, you know, we need to have improvements in testing so that we can get more people identified appropriately, get a better treatment. But I wish these doctors would actually read.
Yeah.
Just read a journal once in a while, pick up a journal. And the infectious disease doctors, unfortunately, who really should be the experts in this field, they tend to be the ones that are the most adamant that there's no such thing as chronic Lyme. In fact, the IDSA, the Infectious Disease Society of America, they actually just came out with new guidelines. And the IDSA is pretty much what dictates what the CDC does. They follow IDSA recommendations. They used to say, we're going to do, 10 to 21 days of antibiotics for Lyme disease, and that's all you need. And they've now revamped it, I think, down to no more than 14 days. So here's what's crazy about this. You're going to love this. You guys sitting down for this? Okay, this is how crazy it is. So if you get a standard like strep throat or staph infection, 7 days, 10 days of antibiotics does the job. Most bacteria in your body replicate about every 10 to 20 minutes. So you don't necessarily need a long course of antibiotics to get that infection under control. If you get exposed to tuberculosis, they will put you on 3 hardcore antibiotics for 9 to 12 months. Why did they do it for so long, and why did they hit it so hard? Well, tuberculosis is slow growing. So tuberculosis replicates about every 15 to 20 hours. So again, if most bacteria are every 10 to 20 minutes, 15 to 20 hours is pretty slow. When you look at the research on Lyme, it's every 1 to 16 days.
Wow.
Days. So wait a second. If tuberculosis needs 3 hardcore antibiotics for a year, and it's every 15 to 20 hours, Lyme's every 1 to 16 days, but we're going to give you 1 antibiotic, typically doxycycline, for a couple of weeks. How does that make any logical sense?
Right.
And so I think this is also where people are getting shorted, that, even if you do identify that you had that exposure and you caught it early, and even if your doctor agrees that you have Lyme, they give you 2 to 3 weeks of antibiotics, you may have gone through 1 replication cycle of Lyme. And we know with doxycycline actually doesn't kill Lyme. All it does is it stops it from replicating. So basically kind of keeps it at bay. But what if your immune system's not primed to take care of it on its own? What if you have some other kind of underlying immune issue? What if you have something else like mold that's suppressing your immune system? That antibiotic isn't really killing it. It's just kind of holding it. And
right.
it's only going to work when it's in a replication phase. So again, we just have so many, non-congruent treatment approaches to how Lyme actually functions in the body that, again, I don't understand why they haven't changed that criteria.
Yeah, and when you brought up Johns Hopkins, I wanted to touch on that too, because a lot of times people think that the only treatment for Lyme is antibiotics, and that was a concern for me because of my history with antibiotics. For 2 reasons. I've been on antibiotics so much and never felt any better, so it really wasn't working. And I took them I was on like vancomycin, daptomycin for IV for a week, and nothing ever touched anything for me. And they weren't trying to treat Lyme though, but also, because I had such a horrible experience after being on antibiotics so long, I was very reluctant to have somebody tell me I need to get back on antibiotics to treat what I now know is chronic Lyme. So can you touch on that a little?
Well, in my world, again, I'm a naturopathic doctor by training. So, we learn a lot about herbs. And so for me, herbs are a great choice for a lot of reasons. The downside to antibiotics, of course, is it completely messes up your gut. It actually, in the effort to kill Lyme, there's collateral damage that's going to wipe out a lot of your normal microbiome. And we're learning so much in the last, decade, especially about how important your microbiome is for sustaining your immune system, for modulating, your risk for heart disease and diabetes and cancer and weight and sleep. So the more we start, goofing with your gut bugs, there's a downstream impact that can be, beyond what Lyme itself is doing. We also know that these long-term antibiotics damage your mitochondria. And for those who don't know, mitochondria are these little parts of your cell that literally create energy. So if your primary problem is fatigue, you're going to have a very hard time overcoming that chronic fatigue when you've got a medication that's constantly undermining your ability to literally make energy. So the advantage of herbs is that they can be very effective at targeting the organism without having that same negative impact on your normal microbiome. They don't damage your mitochondria at all. Plus, herbs have a lot of different constituents in it. They might have a dozen to hundreds of different things. So, they're anti-inflammatory. They boost your immune system. They promote better circulation. They help soothe your gut. So, we can mix and match these herbs for each individual to find out, what combination do we need to really address the totality of everything that Lyme has done to you without necessarily, again, causing those damaging effects. But again, even, with herbs, because Lyme is a slow growing organism, it's not uncommon that people are on treatment for, often months.
Yeah. I had something I was going to ask you and I forgot, so let me see if it comes to me. Totally lost my train of thought. I have Lyme disease.
Brain fog is a very real thing. Train of thought is a very real problem. Yeah.
So do you ever treat with antibiotics?
I do. It's funny. I got a post on one of my Facebook pages today where someone commented they were appalled that I would even, mention that antibiotics at all. And they, railed me that, well, it damages your gut and it's horrible. I'm like, look, everything has its place. And it's not that I never use antibiotics. There are times when I think they are appropriate. I think with acute Lyme disease, antibiotics are very appropriate. And there's a lot of reasons I might use antibiotics. Now, I got to be honest, I still rarely use antibiotics, even for acute Lyme disease, because I think herbs work brilliantly. But there's sometimes, look, I have patients who are lower income. Herbs can be expensive. Even some of the herbs I use, they work great, but if it's an out-of-pocket expense, your insurance company will pay for doxycycline or amoxicillin, and if we're going to use that for a relatively short term, that may be the better economic way. And I feel like there's things we can do to help support your gut so it minimizes that negative impact of the antibiotics. So I think for acute Lyme disease, there's that window. If your exposure has probably been within a matter of months of exposure, I'll say maybe 2 to 3 months, I think there's an opportunity that can be helpful. When you get further away, if we think your exposure happened, years ago, I think the likelihood of the antibiotics working goes down. And look, most of the doctors out there that treat Lyme, especially if they're medical doctors, they tend to use a lot of antibiotics. It's not good or bad. It's just different. I mean, my approach is different based on my training and experience. And look, as a Lyme patient, I was on antibiotics for 9 months. It made me worse. My gut was a mess. I lost 30 pounds in 9 months, and not in a good way. I mean, I could have afforded to lose it, but not in a healthy way. And when I started on Chinese herbs, within a month, I felt 85% better. So I know that there are some people who do benefit from antibiotics. But what I see often in my practice of people who've already cycled through oral and IV antibiotics either had no benefit at all, or they got so many side effects that they just couldn't continue treatment, that we need another alternative. And herbs certainly can, fit that bill. Again, I'm fortunate in my world that, this is my training, this is my background. A lot of other, particularly medical doctors, osteopathic doctors, chiropractors, botanical medicine's really not their wheelhouse. So they may not necessarily be as familiar with these different protocols. But, you got to give it time. With any treatment, the treatment often ends up being, weeks to months. But I do expect to see improvement within a certain time frame. And, particularly with herbs, I tell everybody, whatever we're going to start with is a starting point. We're not married to it. We need to give it a chance to do what we want it to do. 2 to 3 months is usually kind of my minimum. And if we see the needle moving in the right direction, great, we'll stay on it. If we don't see the needle move at all, then we need to shift gears. So I don't like when I see people like, yeah, I've been on this treatment for, 2 years. I don't feel any better. I'm like, well, clearly whatever you're doing is not helping you. And again, if it's antibiotics, there's a good chance it's actually undermining your body, your immune system, and maybe causing more harm than good. I had one patient in my practice when I lived in Connecticut who was seeing a very well-known Lyme doctor who I respect. They had been on antibiotics for 12 years continuously, and they were hospitalized 3 times because of the antibiotics for C. diff infections and other types of problems. So, in my world, at what point do you draw a line in the sand and say, hey, this is really, it's too much, and we're not seeing the clinical benefit. So I think, if you're one of these people where you're now kind of in the Lyme, hamster wheel, have a conversation with your doctor about what's the realistic expectation of what you're doing. And if you don't meet that goal, don't be afraid to try something different. And if your practitioner isn't really experienced in this particular area and you need to get in the hands of someone who is, don't feel bad about, finding someone who's going to take a different approach. I mean, for someone like me, I don't think any of us really have too much ego in the game. You know, we all want what's best for everybody. And if I'm not the guy to do it, somebody out there might have a different approach, and that's fine. You know, ultimately, you have to be responsible for your health. You have to be your own best advocate. And if something ain't working, it's just time to find another approach.
Right. Yeah. So this might be like, okay, so if somebody does suspect that they have chronic Lyme, and we know that not all fields really appreciate or even acknowledge that it exists. So what do you do? Do you just go to your primary care? Like, how do you find a Lyme literate doctor? I didn't even know what that term meant until I started learning about Lyme, but there's such a thing as a Lyme literate doctor, and there's doctors who understand Lyme. How do we go about finding them? For me, that was very overwhelming, and it prevented me from even seeking help for another 2 years before I actually started doing the work.
Yeah, it's a great question. You know, I think part of the difficulty is that a lot of doctors, particularly medical doctors who do antibiotics, because there's a lot of scrutiny from medical boards, depending on the state that you're in, some states have passed legislation to protect doctors for treating Lyme. So the medical board won't go after them if they're using long-term antibiotics. Other states are very aggressive against doctors who treat Lyme. So a lot of doctors who treat Lyme kind of go under the radar. They don't want to get on the list of medical boards who feel like they're over treating. You know, for someone like me, you know, treating with herbs, it's in my scope of practice. It's not weird or unusual. So there are organizations out there like, you know, ILADS, the International Lyme and Associated Disease Society. The doctors who train through them, again, most of their protocols are antibiotic driven, but they certainly understand how to diagnose and how to look for Lyme. ILADS doesn't publish an online database, but you can email them and say, hey, I live in Wichita, Kansas. You know, is there a practitioner that you can refer me to? And they'll email you back with, you know, someone who might be close to your area. A lot of functional medicine practitioners have some understanding of Lyme, even if they're not Lyme experts. They might be a good place. So, you know, IFM, the Institute for Functional Medicine, a lot of naturopathic doctors, the American Academy of Naturopathic Physicians. You know, you can look at these organizations and see if you can't find someone. Most of us, you know, create some sort of online profile that say, you know, that we're Lyme literate. I mean, there's no certification for this. These are just people that have done some extra training in, you know, Lyme disease. So there's no such thing as being certified by ILADS or I took a test that proves I'm Lyme literate. It's just, you know, someone has to have the experience. But again, most of us will list it on our website, list it on our profile. But there's a few different organizations to start with that you might be able to find a Lyme literate. And then ask around. You know, most of us are connected on social media. You know, go on your Facebook, Instagram account and say, hey, I'm looking for a good Lyme specialist. Anybody have a good recommendation? You know, the one thing that's really changed, I think, in 2020 with COVID-19 is that a lot of us doctors are now online. You know, we're doing telemedicine. So most of us, I mean, I've been doing telemedicine even before COVID-19, but a lot of us do work remotely. So if you're in an area where maybe you don't have a local practitioner, you can definitely reach out to any of us that have an online presence. And most of us are happy to work with you. And particularly if we can work in conjunction with your local practitioner. So if you do need something locally, you got that person who's your go-to, but we can at least help guide the Lyme part of your treatment and make sure that that's on par.
Yeah, that's a lot of people were asking, like, how could they see you in particular, someone like you? And there is a virtual option. So I'm glad that you mentioned that.
Yeah, we always love people to come visit us in sunny California. And gosh, hey, Disneyland's going to open next month. So, you know, California's starting to reopen again. But yeah, for people, I know it's just for a lot of reasons it may not be practical to come visit me in person. We do have an option of doing a virtual meeting.
Yeah, okay. I don't know if I had any more about Lyme, so I might leave it there. And I don't want to take too much more time, but maybe if we could just touch on mold for a minute, and then if there's a lot more interest in that, maybe we could hang out again sometime. But I wanted to ask about mold. Like, where do you start if you suspect that you've been exposed to mold, or what are symptoms of mold?
So mold the symptoms of mold, and I guess I should qualify that there's two ways you can react to mold. So you can have mold allergy. This is an immune reaction to mold spores. So anytime you get into a moldy environment, your immune system can react, and it's allergy stuff. So it can be nasal congestion, it can be cough, it can be brain fog. Mold causes a lot of neurological symptoms. So if I took all the symptoms of mold and mycotoxicity and compared it with Lyme, there's probably a 75–80% overlap. So it's the one thing I think mimics Lyme more than anything else in the world. So there's mold allergy, and then there's mycotoxicity. So mycotoxicity is the effect of being in a water damaged building. So if you have a home, a school, a place that you work at that had a leak in the roof, a pipe that burst, a kitchen sink that was leaking, is that water starts to pool, these molds can grow, and they secrete these chemicals called mycotoxins. You breathe them in, and they're fat soluble, so they like to go to the fatty parts of your body. So your brain is a big glob of fat, so that's why we see a lot of neurological problems with mold: brain fog, fatigue, memory problems, sleep problems, mood changes. I have some patients, when they get around mold or mycotoxins, they get horribly depressed and moody. So, it's always a good idea that if you're suspicious about your home, particularly if you knew that there was a leak, I can promise you that 90% of the leaks are not remediated appropriately. You call the contractor, say, hey, I got a leak in my roof. The guy goes, okay. He kind of just patches it up, gets rid of the water stain on your drywall, and they don't take the appropriate measures to look for mold and make sure they remediate appropriately. So if you're ever suspicious that you've had a leak in your home, get a mold inspector to come out and actually test your home, find out what's there. And again, we might want to do this another time, because that's such a very long conversation of different types of mold testing that's available. But you want to make sure you have a reputable mold inspector that can help identify what's in the home. There are different ways you can find out which rooms might be more impacted, and if so, then you can get a proper remediator to come out, clean it up appropriately, because we want to make sure that your environment is safe. Because if you have ongoing mycotoxin exposure, you can be doing all these other great treatments, and sometimes they're just not working because that thing is still causing the ongoing exposure and your body's still reacting. So, we want to make sure your home is safe. There is a urine test that's available that we can see what your body burden looks like. So we can actually see if you've had exposure to mycotoxins. It is a urine test. It's not telling me exactly what's in tissue, but at least gives me an idea about what you've been exposed to. Again, doesn't tell me the when or where that exposure occurred, but at least tells me that, yes, there is something in your body we need to get rid of. And we do have treatment strategies that we can help mobilize it out of tissue and actually get your body to excrete it. So again, depending on what your mold load might have been. I mean, I had one patient where she and her son lived in an apartment they found out had very toxic levels of mold. I tested her son and her. The son had sky-high levels. Her levels came back 0. I'm like, there is no way you're 0, because we know you were in the same environment. So some people are very poor excretors. They just don't mobilize out of tissue. And if you don't get rid of it easily, it builds up in your cells and it makes you very toxic, and that can impact the way you feel. So again, mold gets to be a little bit more complicated, but again, because there's so much clinical overlap between Lyme and mold, it's one of these things where almost right off the bat, we're kind of looking at both when you've got similar symptoms, just to know what we need to do, because the treatment path is completely different. And then sometimes we have to dig deeper. That is it mold allergy? Is it mycotoxicity? It could be both. So, mold allergy people tend to get worse every time it rains, every time it's humid, every time they're in a damp environment. Their symptoms will fluctuate as the mold count goes up, where mycotoxic people are a little bit different. Their symptoms tend to be more consistent because that exposure to water damaged buildings tends to be more consistent. Obviously, we want to get people out of that environment or get the remediation as soon as possible. But yeah, we might want to have that conversation again, because that's a pretty long talk.
That would be good. I was glad that you brought up, because I was going to ask, like, how can two people live in the same home and one be experiencing these mold symptoms and the other not? And it's because our bodies are all built differently, and some of us can excrete, like you said, better than others. Like some of us can detox better than others. Some of us have
exactly
as a prior experience and exposures too. Right.
Yeah, and I think my experience with most people with chronic Lyme is they tend to be poor detoxifiers. I think that's part of what contributes to any kind of chronic illness, is that your body's ability to get rid of junk is less, therefore it accumulates faster, and little things can affect you more profoundly.
Yeah, okay. Yeah, I think we should probably do. I see a lot of questions coming in, like more mold talk, so that'd be cool to break that down another time. I just don't want to turn this into like a whole, like a Netflix and chill binge episode. Yeah. And if you, well, let's just get into that another time. But what do you think the diagnostic reliability is of the, like you talked about the Great Plains, the urine test for mold? Because there's a lot of like back and forth about that in the world too.
Yeah, it's interesting. I mean, Great Plains does mycotoxin testing, Real Time Labs does it, Vibrant Health now has a mycotoxin panel. I was actually just at the conference with Dr. Jill Krista. She's a mold expert, and she's been finding that the Vibrant Health panel, she thinks correlates more clinically with what she's seeing with her mold patients than some of the other labs. I've used Great Plains Labs for many, many years, at least since the inception of their test. At the end of the day, we're just finding a way to try to access, what that exposure has been. Very interestingly, I've had a few patients that did real-time labs and Great Plains at the same time. I don't know why they did that, but they did. And we did see conflicting results. They use completely different technology. I think I trust the technology that Great Plains does, again, being a former lab guy, a little bit better than Real Time. But Real Time's been around a long time. Again, I think they're a good lab. They just use a different technology. So, again, if you've done mycotoxin testing and everything came back looking normal, I might even recommend using a different lab just to kind of cover the bases to see, is it really normal? Maybe it's just that technology didn't pick up on it. And again, if you're a poor excreter, it might look normal. It doesn't mean you don't have it. So we run into similar problems as we do with Lyme testing. It's not perfect. A negative test doesn't always exclude the possibility of being exposed to water damage building, but all we can do is the best way to try to assess it and see what that exposure is. And sometimes we just do treat clinically. We'll start the process of mobilizing mycotoxins and try and get them pulled out anyway. A lot of these things we do to mobilize mycotoxins will actually help get rid of other toxins anyway. So it's not like we're only getting rid of mycotoxins. So there might be a strategy to help detoxify you anyway, but it's nice to have something objective that we can compare your results from time to time to see, are we really getting these out of tissue and mobilizing it in the right way?
Right. Yeah. I think too, it's just similar to there's no one that doesn't become exposed to mold. It's in our environment and
it's everywhere. Exactly.
It's healthy, but it's when it gets out of hand is when we can see a problem with people who aren't able to excrete it as well.
Absolutely.
But yeah, I think that'd be a great conversation another day. I'm going to finish with asking you to, can you share with us, in your experience and with all your education and training, is there any one thing or a couple of things, your top tips for helping us to have the best health or the best ability to prevent or treat or overcome these kinds of chronic ailments that you're so familiar with?
Well, I think, there's so much you can do for free to help your health. That doesn't necessarily mean going to an expensive doctor and taking expensive supplements and doing all that. You can control what you put in your mouth. You can eat good food. You can eat clean food. You can eat real food. You can plan on getting to bed on time and getting good quality sleep. Some people, can move your body and not be sedentary. I think we have a lot of things that are at our disposal that we can take advantage of. And I think the one thing that COVID-19 did in many ways, because a lot of people were at home a lot more than they used to be, they had that opportunity to actually sit down as a family and have a good meal, actually get outside and get some fresh air and move their body because they're not at work all the time. So, do the things that you can, control your environment. And, what I love about your Instagram page is that you get all these great tips on how to live a less toxic life, all these great things on how you can swap out toxic stuff for clean, natural stuff. If you lower your body burden, you give your immune system every opportunity to function at its highest level. So start with the simple things. You don't have to overcomplicate it. I talk a lot about my book about that whole thing about control the factors that you can. And then from there, depending on how you feel, if you need to step it up a notch and start working with a healthcare provider that can give you that extra guidance, that's great. But there's just so much you can do on your own and be your own, again, best health advocate. Don't wait for a doctor to heal you. That healing comes on your own. We can do things to kind of help, get those obstacles out of the way. But so much of this is in your hands, and you've got the power to make your life so much better.
Oh, I just love you so much. Thank you, Dr. Ingels. If you suspect that you might have Lyme or someone that might have Lyme, this book is such a good guide. It has in the beginning, there's symptoms to check off to try and figure out if it is something that you might need to test for, and just so many other great tips like Dr. Ingels just shared about how to control your environment and to do what you can with what you have, what you're able, and as it makes sense for you, and then steps that you can take so that you can really lock down an accurate diagnosis and steps moving forward.
Yeah, and I should mention that I have an online questionnaire. So if people go to my website, you can take the free quiz. It gives you a score, and that will give you an idea about, whether you might have that exposure, and at least, gives you an idea, do I really need to pursue this further with a healthcare practitioner?
Yes, his book's in my Amazon shop, and you can find it lots of. It's like where else? It's on Amazon and like, I mean,
Amazon and anyone who sells books, which I think
yeah,
now is only Barnes and Noble, right?
yeah. I'm gonna start slanging them. Yeah. But yeah, so thank you so much, Dr. Ingels. I think we should get together again another time, chat mold and other fun stuff.
Awesome. Well, thank you so much, Shauna. This is great.
Thank you. I'm gonna try and save it. So everyone, wish me luck. Bye.
All right. Good night.